since 1966.
This is NBC4's News Conference with Conan Nolan, Southern California's longest-running public affairs program.
On this special edition of News Conference, there has been progress amidst the heartbreak as California has become the model for flattening the curve in the COVID-19 pandemic. But what will eventual success look like, and how much longer will it take before life can return to normal? We talk with Dr. Rimoin, Professor of Epidemiology and head of UCLA's Center for Global and Immigrant Health. California Surgeon General Dr. Nadine Burke on strategies to address the crisis in mental health and the stress and anxiety that have been the unwelcome byproducts of the response. Janet Napolitano, the president of the University of California, on what the UC system is doing in the fight against coronavirus, and when will students be able to return to class. And we hear from a young doctor from Hollywood, now on the front lines of the epidemic far from home at Boston's Massachusetts General Hospital. What she has learned and what she'd like to say to those of her generation who still aren't taking this crisis seriously. Good morning and welcome to the Tom Brokaw News Center here at a very quiet Universal City. I'm Conan Nolan. We pray on this Easter Sunday and Passover that you are in good health. Up first, Dr. Nadine Burke, the Surgeon General for the state of California, formerly with Stanford University's Medical Center. She has a master's from Harvard University. So, Doctor, the message from your office, stay the course, be positive, or at least as best you can.
That's absolutely right. The governor and all of our teams across the state of California are working incredibly hard to mitigate the economic impact while we are working hard to save lives of Californians. And while we're doing that, one of the things that we want to keep in mind is, number one, for us to recognize that this too shall pass, right? At some point down the line, we will be able to ease up. But right now, it's really important for us to stay consistent with our physical distancing and also try to stay positive, right? To preserve our mental, emotional, and physical health during this time.
But you've talked about the mental health aspect to all this. A lot of people are starting to suffer by just staying at home.
Well, that's right. What we see is that a lot of us are feeling a lot of stress right now, from stress and anxiety about the virus and being in the middle of a pandemic, but also the stress about the necessary mitigation measures that it takes for us to fight the virus. Staying at home, lots of folks are concerned about lost work and having economic anxiety. And with physical distancing, right, we miss that connection with other people. And it turns out that social connection is actually really important for our health. And what we've done is that we've put together a playbook, the Surgeon General's playbook for stress relief during COVID-19, that's available on the website covid19.ca.gov to help people to be able to mitigate some of those effects.
Very quickly, talk to parents about the stress their children may be experiencing.
Yeah, so stress in kids can show up a little differently than it does for us as adults. They may not be able to say, wow, I'm feeling stressed out. For kids, it may be, depending on their age, changes in their sleeping, right? Or their developmental milestones. A child who had been potty trained may regress and go back to bedwetting. Or some kids will have headaches or tummy aches. Teenagers may have mood swings. And we can also see worsening of chronic health conditions like asthma or diabetes. And so it's important to put into place measures that help to reduce stress hormones, right, that are kind of going in overdrive right now, with things like exercise, meditation, and good nutrition.
California Surgeon General Dr. Nadine Burke, thank you for taking the time.
Thank you.
We're now joined by Dr. Andrew Rimoin, Professor of Epidemiology and Director of UCLA's Center for Global and Immigrant Health. Dr. Rimoin, you have been an advocate for more testing, that it's the key to relaxing the guidelines and stay-at-home orders. Why?
We need to know how many people have already been infected. We need to know how many people have recovered. And we need to know who may have some sort of immunity to this and who doesn't. We need to be able to have excellent case investigation and chains of transmission and stop them in their tracks. We need to have robust hospital capacity to be able to take care of patients as we have them. That means we need to have all of these things like the ventilators, the PPE for our healthcare workers, all of these things in place so that when people do get sick, we're able to handle that. And then, of course, the last thing that we need is we need to have a reduction in the number of community cases. And that is this idea of really pushing down, flattening the curve. And all of those things are needed to be in place for us to be able to even consider opening up our economy again.
Still, though, some are suggesting that the governor start opening things up in May. People like you are saying we need to be cautious, that we must maintain the status quo.
It's very important for us to maintain the status quo. What we know now is that we're seeing the benefit of all the hard work that all of us have done to be able to flatten the curve. We're seeing a slowing down in terms of the number of cases. Our hospitals are able at present to be able to keep up with the demand. And so we are doing our job at flattening the curve. And this is really because here in California, we've been way out in front, putting in social distancing measures, making sure that people are staying safer at home, closing businesses, doing everything we can to make sure that this virus has has less of a possibility of spreading from person to person. And so right now, it's our job to double down, to be able to reap the benefits of all of the hard work that we've done. If we open up our economy again, if we start loosening restrictions, we will see a rebound in the number of cases. And that's because this virus is new to all of us. Not enough people have immunity to this virus. So all of the things that we've been working so hard to prevent will happen if we open up too soon.
You and others say victory will require a vaccine. That could take time, maybe a year or longer.
That's true. To be able to get a vaccine developed through all of the phases of clinical trials and having good safety and efficacy data do take time. And so we are trying to accelerate that timeline, but still, as everybody, Dr. Fauci, WHO, all the experts have said, this will take time.
Dr. Ann Rimoin, director of the UCLA Center for Global and Immigrant Health, thank you for taking the time.
It's my pleasure. Thank you.
Up next, UC President Janet Napolitano and how the university is handling all this. And then later, reflections from a medical doctor just starting her career while on the front lines in this fight against a global pandemic when we return.